If you'll remember, 2020 was an election year, and all of the fellows going into their placements in that year were told by everybody, oh, nothing ever happens in an election year. And as it turns out, we faced the largest public health challenge in the last 100 years.
So starting out in 2020, there were a number of things that were hoped to happen or at least get refined. In the Speaker's office, we were focusing on a tobacco bill, trying to get especially vaping in young people more limited. We were working on surprise billing and trying to get a handle on consumers getting surprised with giant health bills that they thought were going to be covered by insurance. We were also needing to work on renewing some of the legislation that funded public health initiatives, community health centers, some residency programs. So we had a number of important bills that we were just working on refining the policy, getting them written, getting them through. And then in late January, some people in China started getting sick and actually wrote some memos for the speaker and for a congressional delegation. And at that time, the most I could imagine is if this is worse than they're saying and it gets into North Korea, that could be really destabilizing because there's really close economic ties between China and North Korea. And that's when we were very concerned about even potential military action. Between the US and North Korea, there were a lot of tensions. And by the end of February, it was pretty much all COVID all the time.
During these massive economic development and public health response legislation, they were the only people that had the frontline experience to be able to advise our policymakers on the best course of action.
March 13th, Friday the 13th, was our last day in the office, and that was the day when the chiefs of staff let us know that we should plan on working remotely for at least several weeks. And we went remote, which meant we were home, but still trying to juggle an incredible amount of work on conference calls and email chains that were bouncing back and forth. And in many ways, the work got a lot harder once we were remote. Because we just didn't have a history of working that way together and didn't have some of the systems in place to make it effective.
Our fellows were involved in every bit of response to the COVID emergency. And in that year, ended up passing $4 trillion worth of legislation, most of which had to do with pandemic response and recovery.